Well, glaucoma is a disease that affects a lot more people than you might think, including some well-known celebrities like YouTube's Bono and Whoopi Goldberg. But many of us don't know too much about how it's preventable and also how it's treated. Well, January is Glaucoma Awareness Month, and here to talk to us about the disease is Dr. Carolyn Cruvant. Did I get that right?
Yes, you did.
Excellent. From the Shepherd Eye Center. So, it's really interesting when we're talking about, how serious this disease really is. It is the second leading cause of blindness, according to doctors and research.
Yes, in the world.
In the world, okay.
The problem is it often goes undiagnosed and untreated. It is a blinding disease, a progressive degeneration of the optic nerve, which is this bundle that leads to the brain and transmits vision. It's usually associated with elevated intraocular pressure. And when it goes undiagnosed and untreated, it does result in blindness.
I guess what population of folks tend to be more affected by glaucoma? Who should really be in that risk category?
Well, everybody is at risk as we get older. Age is a major risk factor. But if we have a family member with glaucoma, that's an extra risk factor for us. Or if we have a personal history of certain medical conditions like diabetes and hypertension, that's also a risk factor. Also being very farsighted or highly nearsighted can also increase the risk for glaucoma.
And you brought some things to kind of show and tell how you would detect glaucoma and how this works. Tell us, how you would do if you were in your office, what you would go about doing to find this.
Thank you. During a routine eye exam, in addition to checking vision, we check the intraocular pressure with a device with numbing drops, so there's no pain whatsoever.
Important.
We can just touch the surface of the eye and check the pressure.
Oh, okay.
In addition, it's very important to dilate the eye and examine the optic nerve, because it's the nerve itself that's damaged in glaucoma. And even though
leading to the brain. Okay.
Exactly.
Again, here in this camera here. Okay, leading to the brain. Okay, very good. And if you were to go about what type of treatment do you go about when you're trying to treat glaucoma?
Well, glaucoma is treated with three types of modalities: medication in the form of eye drops, laser, and surgery. And most people start out with one drop once or twice a day. Many of them will never need to use any more than that, but many people do need an adjustment of their medication. They'll use 2, 3, or even 4 types of eye drops several times a day. Laser is used for different types of glaucomas, and surgery is used for certain types of glaucomas and for very advanced cases.
Well, this is Glaucoma Awareness Month this January, so Dr. Cruvant, doing your part to try to raise awareness and let people know what, how serious this can be and what they can do to avoid getting this disease. So thank you so much for being with us.
My pleasure.
We appreciate you informing us and informing our viewers at home. So thank you so much for coming on the show.
Thanks again.
All right.